Your consultant will decide what type of radiotherapy you'll be receiving. Depending on whether or not you've had surgery or not, you'll be having your breast and potentially your nodes treated, or if you've had surgery, your chest wall and also potentially your nodes. Then depending on which side we're treating, we will also be treating you within a deep inspirational breath hold, which will require you to take a deep breath while we're treating you.
The things that can vary are which areas we treat. So we will usually treat the breast or the area where the breast was if you've had a mastectomy. We may treat the lymph glands above the collarbone as well. We may treat the lymph glands in the armpit. And for a woman who hasn't had a mastectomy, sometimes we will give a bit of extra radiotherapy to where the cancer was, a small area called the tumour bed. Most of our patients will have 3 weeks of radiotherapy where they're given 5 sessions a week for 3 weeks, so a total of 15 sessions. We will have some people having an extra 1 week of radiotherapy afterwards, 5 sessions to the area where the cancer was if they haven't had a mastectomy.
Your radiotherapy appointment will be about 12 to 15 minutes. The majority of this will be time to set you up. The treatment itself lasts about 3 or 4 minutes.
You're given 5 days on and 2 days off, and that doesn't necessarily mean Monday to Friday with the weekend off. It can often fall over the weekend. And the times can vary from, I think the earliest was about 8:30 to 2 o'clock. So they can vary quite a lot throughout the day. So you are kind of at the mercy of the appointment times. It looks quite daunting when you look at that sheet to start with, but you fall into a new habit of doing it, and it just becomes part of your daily life.
When you check in at reception, we will then see that you've arrived, and one of the team will come down and meet you at reception. We'll then bring you up and come into a side room, and again, like at pre-treatment, we'll just run through the treatment process. From the second day, you then check in and you'll walk straight down that corridor, and we'll meet you at the waiting room closer down to the machines. We try to keep you on the same machines for your treatment so that you can get used to the same team. However, due to service capacity and different reasons, sometimes we do have to move you between machines. Within our treatment area, you do have a side area where you can sit and you can get changed. There's a curtain you can draw. And again, we can provide you with a piece of paper to cover your chest.
My advice would be to wear something that's very comfortable and easy to get on and off. You are naked from the sort of mid up, but your dignity is there the whole time. You can have a piece of paper that covers you to get you to the machine, and when you get off the machine as well. So it's all very private, it's all very confidential. The first time you do it, there is an element of I'm naked, but everybody is so nice and so friendly, and you know it's what they're doing every day, and that they're there to do that specific task for you, that after a while you forget that you don't have any clothes on, really.
We do have to have you remove your clothing so that we can see the permanent marks that the pre-treatment staff have put on you. But also, the radiotherapy will react with metal, so we ask you to remove any necklaces, and the metal within the bra would also cause a reaction, which we want to avoid. The breastboard that we have is the same in the CT area and also in for treatment. It will be set up for you individually every day, and that is specific for you and for your treatment. Unfortunately, the bed has no padding on it, and there is a reason for that. If we had a mattress on there, you would roll around, and because we're trying to achieve accuracy within millimetres, that would allow you to shift, and that is what we're trying to avoid. We use the permanent marks that have been put on, and these help us to align you with laser tattoos we have in the room. We'll move your arms a bit, we might have to move your shoulders, and sometimes we have to roll your chest a little bit. The best thing to do is try to relax as much as possible. Sometimes you may find that this positioning actually takes longer than the treatment itself.
They read out a lot of numbers to each other. It's a little bit like going to the dentist when they read out all the things that are, in your mouth. There's all this kind of technology and terminology that's being said around you. But you don't necessarily see the lasers, but you're aware of what they're doing. They ask you to try and remain as still as you can and not to move yourself. They will move you to make sure they've lined you up in the right position. If you're not comfortable at any point, you can say, my arm's not quite comfortable, and they'll readjust you. They won't do it unless you're fully comfortable, because you've got to lay still. I would try and pride myself on being able to get on the bed as quickly as I could and line myself up. It became kind of a little bit of an obsession of mine towards the end.
When we're setting you up, once we have you in that position, it's crucial you remain in that same place. If you need to sneeze, just sneeze and relax again, and your body will relax into the same position. However, we ask you not to try to scratch, which can be difficult once you've been left alone. So once we have you set up, we will then leave the room. The energy that we're using to treat you is stronger than a CT scan, so we'll be behind another wall. We can't see you exactly, but we have cameras that are watching you the whole time. So at any point, if you need someone to come in, we'll stop the treatment. We can see you if you wave your hands to us, and we'll come in straight away. We are giving you a treatment using deeper inspirational breath hold. While we are setting you up in the correct position, we will have times where we ask you to take a deep breath and hold that. We need to try to get you to treat the same amount of breath each time. We will speak to you over an intercom, and this will tell you when to take a breath in and when to release. The radiotherapy machine allows us to initially take an X-ray to check we have you in the correct position. From there we are able to deliver a treatment, and that moves around you and it will treat you at 2 diagonal angles. That allows us to miss your lung and your heart as best as possible.
It's very noisy. It's a little bit like waiting for the beeps that you get at the end of a dishwasher cycle. It's kind of like that. Towards the end of the process, you get to know what point that is of the treatment, so you know whether it's the beginning, the middle or the end. So yeah, there are noises to let you know that something is going on, but it's completely painless. There's no pain whatsoever, no discomfort. I'd lay there and plan what I was going to have for dinner that night, or shopping that I needed to be doing, or the time would always go up really quickly before I knew it would be finished.
When the treatment's completed, we will come in, we'll tell you when it's safe to get down, and we'll lower the bed. From there you can get dressed and go home. You won't be radioactive and you're safe to be around other family members and children.
Been a sea change in the technology that we have available. So the shaping of the radiation beam to limit the amount that gets to bits of you or of me that we don't want to treat is just a completely different ability nowadays to when I started training in this area. The other thing that's changed is the ability we have to ensure that each day somebody comes, their treatment is delivered absolutely accurately. We also have much better understanding about what dose of treatment is optimum and how to give that in a way that minimises the risks. So I've seen an enormous change in the technology over my career to the benefit of my patients, which has been great.
I'm very good at compartmentalising things, but when you are laid on the bed and you're on your own, everybody's left the room and the machine's whirring, you're forced to appreciate and understand what's going on every day. So that can take some getting used to begin with. But the process is so quick that by the time you've thought, oh, I'm here again, this must mean I've got cancer, this is quite serious, you're off the bed and you're back on with your life again.